My name is Kenneth Macharia. I'm the country representative for Options Consultancy. Options is a global firm that works in the health sector. So we predominantly focus on maternal and newborn health across the world. Our headquarters are in London, in the UK, but we have offices here in Nairobi covering the East African region. We have offices in Ghana, we have offices in Nigeria. We have a very key focus on the African continent because we believe this is a place that we can make a lot of difference, both in terms of the work that we do, but also just the context that we can bring to the work that we do as well.
Oh yes. So what kind of consultancy services do you offer around this sector?
Sure. So we focus a lot on the international development sector.
Okay.
And so a lot of our work is predominantly technical assistance. So our clients come to us and basically say they have a problem to solve. So in Kenya, for example, we work across over 30 countries in Kenya, delivering support in various forms. So we've worked on maternal and newborn health, quality of care, work with county governments. We've worked around public finance management, so really helping county governments figure out how to work out their budgets and planning so that they can be able to draw down more resources, but also prioritize where they're putting their resources. We do work around the family planning space, also family planning policy at a national level and also at the county level, as well as thinking about the commodity supply chain for those commodities. Apart from that, we also work on the issues of advocacy. We currently have a Pan-African program on ending FGM, and that's one of our main advocacy pillars for the next 4 years. And lastly, we're also working in the area of blood. And this came about because of the work we're doing around maternal health care and around quality of care. And we realize there's a real distinction, or rather there's a real connection between mortality in maternal health and the availability of blood. So that's an area that we're very keen to build on and to help improve the systems across the continent. I also chair the policy platform for COBA, Coalition of Blood for Africa, who are actually at this conference driving that particular agenda.
I think that's really interesting for me, because when you talk about counties, we probably are now into the tail end of the second term. And I believe there are lots of African countries that you work in that don't probably have the same kind of system that we have here. And since you work with them, tell us a bit, what are some of the opportunities that have been taken care of much better because the counties actually existed in this country?
Sure. I think the issue of devolution was actually a very good idea. Excellent idea. I think what we've encountered and what we realize as we've devolved a lot of our governance to the counties, on the positive side, it's brought resources to the counties and to the people, and so you can see the difference it's made to those counties. On the flip side of that is that I think we needed to have taken time to think about some key sectors. I'm sure you've seen a lot of issues on education, but I'll speak predominantly around health. So there are a couple of things that we needed to really think about the issue of our health. First of all, are we ring-fencing funding to healthcare? Right? That has not necessarily happened, and as a result, we have patchy development. One county could be doing much better than the other because of who's in power. And so the question is, can we find a common way of prioritizing resources towards health and the provision of health services at the county level? So I would say that it's actually a positive thing to have devolution, but we have a lot of work to do to ensure that the systems work. The issues around human resource at the county level, how do we hire, how do we retain the right people to be able to deliver the services that our citizens require? So there's a lot to do, in terms of streamlining and just making that whole process work better. So for us, our work, our learnings have been that, especially on the finance side, that there's a lot that we could do to ensure that the resources that we draw down from the treasury is actually prioritized properly and utilized in the right places.
Now, if you look at this morning, I think the discussion that really caught my eye was the blood one, and showing the National Transfusion Service really breaking all the records after all these years, but still the numbers are still not where we need to be. But I think there is that question that wasn't really answered very well, the role of the private sector.
Yes. Yes.
What would be, because you guys are consultants, you can always suggest something. What we would, is there some role really for the private sector to come in to fill the gap?
So yes, there is a role for the private sector, and I think it's very clear. I think the Kenya National Blood and Transfusion Service, I think they're aware of the need for the private sector. I think what is holding back the engagement of the private sector, or the private sector being involved more, is just the regulatory framework that would allow for the private sector to come and invest and actually, in a responsible way. Yeah. Because the issue of blood is also very sensitive. We still have to ensure that it's safe. We have to ensure that there's correct framework to allow players to be part of that, at the same time ensuring that it's actually affordable. It's actually, because blood should be affordable. It should be free for those people who need it, because there are a couple of things on blood. So there's a giving of it, but there's a cost to process the blood. So the question is, how do we manage the cost of processing that blood and ensuring that it's available when you need it? Right? And here when I talk about when you need it, it's wherever you are across the country. And so there's a lot to think about that. And so I think they're on the right path in terms of the framework and the regulations that they're putting in place. But a lot of work still needs to be done, and a lot more dialogue and engagement with the private sector is needed, so that we also figure out who needs to be involved at what stage, and how do we move towards that direction. I think there was a conversation or the question around private sector involvement, especially on the public-private partnerships. So you'll find that the government has invested a lot in that particular area, and we've seen a lot of progress on the public-private partnerships, but it hasn't necessarily been, we don't have examples to speak to in health. But in other sectors, you can see that is actually taking off, and it's a good thing.
Because one thing is that there is this often quoted M-Pesa story, which actually people say that the government kind of allowed the opportunity for trial and experimentation, and then regulation basically kind of was fine-tuned as the product was going on. But I think even when you're talking about some of these things, then it's also down to the basics of adoption of technology and enabling things to work.
Yes.
Now, so what is the space of technology? Even if you leave alone blood, there are many other areas that you guys are advising the development partners across the continent.
Yeah.
Technology uptake.
So I would say as a continent, and when I talk about the continent, I mean there's so many contrasts, right? Kenya is one aspect, then you've got Nigeria, and you've got other countries. So I don't think you can necessarily just say, you have one blanket view across the continent. But just to speak on the issue of blood and where the uptake can come in. So we know that malaria is something that is there with us as a continent. There is technology to remove the malaria pathogen. And so the question is, why can't we adopt that? And so it's these are the conversations that we need to have around how do we plan for our healthcare system in a way that it becomes sustainable. So what are we investing in? The equipment, where do we put it in? Who's paying for it? How does the private sector actor get back their investment.
Oh, yes.
Because this is not a donation. And so we need to find a place where we have a balance that allows them to come in, bring the technology, but at the same time also make a return for themselves, but ensuring that the quality of care improves. You know, think about it this way. You can argue that a new car is expensive.
Oh, yes.
Okay? But because it's new, it's probably consuming less fuel because it's a lot more fine-tuned. The older the car gets, the more inefficient it becomes, and it has to consume. So I think we also need to take that approach that forward investment is actually a good thing, and it could actually make sense in the long run by reducing the cost of healthcare. So today at this conference, I've met organizations that are trying to do technologies that allow people to, for example, do scans at the village setting. That's amazing. But you see, that has to fit in within a system. So there's a lot of conversations around UHC, Universal Health Coverage.
Oh, yes.
And so the question is, what else or what frameworks are in place to allow that to happen? And we always have to think about these things in context, right? Majority of the African continent is also, there's a lot of poverty across the continent. And so people's ability to pay is also curtailed.
Yes.
So we know where we want to be, but we also realize that there are certain challenges that are stopping us from leaping to that point. That doesn't say that we don't work towards that point.
Oh, yes.
It's then thinking about what are those solutions that would work in context for us, right? So even adoption of technology, how does that work in context? And at the end of the day, it also means that we also have to speak to our leaders, right? That we hold them accountable so that they also sell visions that are not short-term, about 4-year cycles, but more a question of, okay, let's talk about the next 20 years. What do we want to put in place for the next 20 years? So even if I'm not in office this year, there's someone else who will come and find something that has been started that has a vision and work towards that. So the question is also of, when I talk about adoption of technology, it also comes down to, are we changing our mindsets to how we are approaching the problem? Because if we continue doing the same things every election cycle, then we'll never get anywhere. It'll also be a very expensive process because each time we have to start afresh.
What is your plan for the next 5 years?
So for us at the moment, the issue of blood is right front and center because we feel that it's an area that we should have solved as a continent. And so the challenge is clear. And so the question is how? And so as consultants, that's what we want to get involved in. We want to solve this big problem that is affecting lives. You can imagine by solving access to blood, that's saving lives. And that has an economic value to it because it also means that, first of all, people don't have to lose their loved ones, lose breadwinners, and as a result, homes and families and communities are also uplifted by people being present. Secondly, we need to also think about it from the perspective of what does this mean for even the healthcare workers? Because some of the decisions they have to make because of lack of blood are, they're heart-wrenching. Where you have to make a decision of life and death on something that a commodity, and I say blood is a commodity, that it should be available when you need it. But you hear a lot of people passing on or not actually having to be transferred long distances because of lack of blood. And so for us, the issue of blood, and especially on the issue of maternal health, is so central to what we want to do in the next 5 years. I think the other areas that we've been working on at the moment is on the issues of health commodities. And so it's thinking about how do we help on the policy side to ensure that the right policies are in place, to ensure that commodities are available when you need them. Right? And that's so critical. So we really want to focus on those two areas. Apart from that, we have programs on public finance management. And that's at the core of everything that happens in health. you cannot have a health system that's not funded. So you have to think about how do you ensure that there's own source revenue. In Kenya, it's a good example. In other countries, Tanzania and others, they have scrapped, for example, fees for maternity, right? But what does that then mean? You need to find those resources elsewhere. How do you prioritize and ensure that the system is also working and there are no leakages that essentially lose money that is so needed for the healthcare system? So thinking about how we help governments to really strengthen their health systems for the future.